Hello. I hope everyone is staying well and managing this crisis as best you can. I continue to be so proud to work alongside you during this time, and I'm really so thankful for your commitment, dedication, and selflessness during this crisis. You are truly modeling our promise and living out our values. In these very uncertain times, I want to take a moment to bring back some certainty into our lives, and I have a few updates for you. The first time we broadcasted from the command center during this crisis, we talked about how we would be able to continue to pay base salaries through April and then reassess around this time. I have some good news for you. The Board of Trustees met this week, and after reviewing our financials, the board unanimously voted to continue to pay base salaries through the end of July in the same manner since our initial communication to you in mid-March. I hope this brings you some comfort and peace of mind. We will reassess our next steps before the end of July, and we will communicate any updates with you. In a time when many companies and healthcare organizations are struggling, I'm humbled and further inspired by our board that we are able to make this announcement. We are able to do so because that same board and every decision maker at Cook Children's have worked together for a very long time to ensure our organization is fiscally sound. Even as we've expanded, we've made sure every dollar counted, and now when times are at their stormiest for so many, that careful planning and preparation for so many years allows us to dip into our rainy day fund during this international crisis. Like everyone else around the state, the nation, and even the world, we are projecting significant losses as a result of COVID-19. But our reserves allow us to move forward and look straight ahead into the future. All of us have a lot of work to do to return to some level of normalcy. But please know that you always have our long-term support. Now, moving forward, we ask you to continue to work with us over the next few weeks and possibly months to come. We will have to tighten our belts when it comes to expenses, whether it's travel, overtime, or hiring. We must be disciplined just like we've always been in our spending to help us build back our reserves for when we face yet another challenge in the future. I want to thank the hundreds of employees who are part of redeployment. Together, we have had the staff available to cover more than 2,100 shifts across the system just last week alone. Employees who are currently not working must be on the redeployment list to be eligible for continued pay. If you're unsure if you are on the redeployment list, please visit with your manager or email us. As we look to ramp up certain services like elective surgery, we would ask you to continue to be flexible in accepting redeployment assignments that may be outside your typical shift, schedule, and role. The board recognizes your commitment to our patients and families and wants to support all of us accordingly, but we all need to be willing to go the extra mile, and we thank you for that in advance. You are probably aware that Governor Abbott recently announced that hospitals and physicians are now able to resume performing elective surgeries in certain circumstances. There are many factors to consider before we decide when and how we are going to do this. We have a multidisciplinary team evaluating what it would take to begin elective surgeries again, possibly as early as next week, for some of our more serious cases where surgery cannot be further delayed for our most vulnerable patients. We will have more information to share on this front in the coming days. As we all continue to respond seemingly by the hour to the unique challenges that COVID-19 presents, I want you to know I appreciate how many of you have been taking care of each other during this challenging time. I want to thank you for so quickly adapting to our COVID-19 guiding principles, which you see here on the screen. The principles allow us to keep our promise during these challenging times, and they help to protect all of you as well as our patients and our families. Please know you are our top priority through all of this. With Hospital and Nurses Week coming up, Spring is usually the time of year when we kick off our annual employee events to recognize and thank you for your hard work and dedication. With social distancing practices in place and your safety and well-being among our top priorities, our employee events have been postponed until it is safe for us to gather together again. I want to close our time together by acknowledging that I know this crisis has been stressful for all of us. Some of you may have added worries with family, financials, and overall well-being challenges. I want to let you know that we have an employee assistance program that is 100% confidential. There are other complimentary services for you here on the screen. Again, this is private, and your personal information and the reason for your call or visit will never be known or shared. It is always okay to ask for help and reach out for assistance. Finally, it is with the utmost gratitude that I say thank you again for all you've done over the last few months and all you continue to do on behalf of our patients, families, and each other. It will take time to get back to the way things once were, but it will be time well spent. We will always remember this shared experience. Together, we will get through this crisis, and we'll be stronger when it's behind us. Thank you.